Watch how I take this bunion deformity and transform it into this with barely making an incision on the foot. Stick around and I'll show you exactly how I did this. So let's talk about bunions. Before we get into how we can fix this through a minimally invasive approach, we should first talk about what exactly is a bunion. So here we go. Let's look at my beautiful artwork. Please don't judge me on my artwork. I know it looks terrible, but I think we can depict what's going on here. This is the normal foot. You can see normal. This is the foot. And then here's a foot with a bunion. So a bunion is essentially a bump on the side of the big toe. The big toe is also known as the hallux in medical terminology, also known as the great toe. You'll see a bump on the side of the toe there. And oftentimes the big toe is going sideways and it's pushing against the smaller toes. So we call this bump a bunion. And this bump is actually a bone that's sticking out essentially. This bone is called our metatarsal bone. It's what makes the ball of the foot. You've heard people say, hey, the ball of my foot hurts, or this is the ball of my foot. The ball of the foot is the metatarsals. And this first metatarsal, we have 5 of them, is pushing outward. And as it pushes outward, it pushes the great toe or the hallux or the big toe to the side. And there are many different degrees of this, and we'll go over that here in just a second. But essentially what's happening is that the bone, again, don't judge me on my artwork here. The bone essentially looks like this. I'll draw it out here. Kind of a circle-like structure. And it gets long here. And it kind of squares off. Comes back up like this. And then there's 2 bones that connect to it. This creates the big toe. And there's another bone. This is the toenail right there. There's another bone that sits right underneath it. Kind of like that. Okay, again, please don't judge me on my artwork. And so this bone is pushing over. And like I mentioned before, there are different degrees of bunions. But before we even go into that, let's talk about what causes bunions. This is actually kind of a complicated answer. I get this question asked a lot by patients. There are many different factors. Genetics plays a role. So if mom, grandma, grandpa, brother, sister has bunions, there's a chance that you may have bunions. And again, it's genetic. Shoe gear also plays a role. Oftentimes women that wear heels, often the toes get really scrunched in the toe box. And so over time, over many, many years of wearing heels, the toes will get deformed and they'll start to go, that way or even this way. But from a bunion perspective, they're going outward. The toes being pushed that way. There can also be diseases that can cause bunions, congenital diseases. There are a lot of reasons why bunions form. So it's not a very easy answer for me to give you, but just remember that a lot of factors play a role in this, and I hope that makes sense to you guys. Okay, so let's talk about the different stages of bunions. Depending on who you read or who you talk to, there's going to be different staging systems, but we'll keep it very, very basic. And here's how I talk to my patients and how I describe bunions. There's basically mild, moderate, and severe. Let's talk about what a mild bunion looks like. So take a look at this one right here. Mild bunion, you can see the toe is going over just a little bit and there's a really, really tiny bump there. And so patients with mild bunions may feel pain with shoes. Certain shoes might rub up against the bunion, especially on the side where that bone is sticking out. Sometimes with walking, they'll have some pain. And then sometimes patients don't have any physical pain, but it's more emotionally painful for them. And so I've mentioned in other videos, deformities like bunions and hammer toes, and we'll talk about hammer toes in a different video. They can be embarrassing for patients, especially female patients that like to show their toes in the summertime, or they like to go to the beach, or like to wear sandals. They don't like the way it looks, and so they get embarrassed by their friends and peers. The moderate bunion, take a look at this one right here. As you can see, the bump is just a bit bigger and the toe is going sideways. The moderate bunion is probably the more common bunion that I see in my practice. Painful to touch. Sometimes range of motion of the big toe is limited. Oftentimes the shoe gear that the patient's wearing is rubbing up against the bunion, especially in the side, and it's causing a lot of pain. And the toes, the smaller toes, are being pushed over to the side too. So it's causing pain not only at the big toe, but also the smaller toes. And again, bringing back this sort of cosmetic approach, patients definitely feel embarrassed, especially the female clientele who want to show their toes off, going to a beach, going to a party, you know, it can be embarrassing. And then there's severe. This is where the patient's neglected their bunion for, you know, many, many years, 10, 15, maybe 20 years. The toe is, you know, we call dislocated, meaning that the big toe is really going over. There's a really, really big bump on the side, and then the toes are going over as well. And here's an image of this right here. You can see it. And so this can be extremely painful for patients. You know, just light touch can even cause pain for them. It's red, hot, swollen. Sometimes patients, the bunion is pushing against the shoe, and you can even see an indent on their shoe. Oftentimes they're having to buy wide shoes to accommodate their foot structure, and so it can be pretty inconvenient for patients, especially women that want to wear heels. You know, it can be very inconvenient for them to find a pair of heels to fit into. So, you know, this is, again, moderate, more commonly seen. Severe, I see sometimes, but this is a patient that has neglected it for maybe 10, 15 years. So a question I get is, Doc, if I let my bunion go, will it get worse? I always let patients know bunions are a progressive disease. They can get worse. Will they get worse? I don't know. And I don't think anybody knows that answer. But they can get worse. It's a progressive disease. So if your bunion was mild 10 years ago, there's a chance that it might become moderate now if it's 10 years old. Or it could even be severe at this point. I often get the question, Doctor, if the bunion doesn't hurt physically, should I get this bunion fixed? You know, that's a tough question for me to answer, because sometimes you'll go to a doctor and they will say, there's absolutely no way that I'm operating on your foot if you have no physical pain. You know, I look at pain from two different directions here. There's physical pain, and then there's emotional, mental pain. And again, coming back to cosmetic approach to all this, you know, if a patient doesn't have any physical pain, but they're just so embarrassed to, you know, show their toes to their friends, their family, their peers, you know, that's pain in my book. And I encourage, if you will feel better with having your toe nice and straight, you'll have that confidence back, absolutely. Talk to your surgeon, talk to your physician about having your bunion fixed. I think that's totally appropriate. And a lot of times we're getting the mix of both the pain from the physical standpoint, but also the emotional pain. And patients are just, you know, they're ready to have their bunion fixed from a surgical approach. So, you know, again, that question, every physician is going to be different with that answer, and there's no right or wrong answer. I do believe that there's both physical and emotional pain, and both of those are reasons to have your bunion fixed. Probably the main reason why you're watching this video, you want to learn how I fix that bunion that you saw in the beginning with barely an incision. Let's talk about the surgical approach for fixing a bunion. I have two things here, traditional approach and minimal invasive approach. The traditional approach is a large incision that's made on the top of the foot. As a surgeon, we dissect through the soft tissue and we get to the bone. Remember, I mentioned earlier in this video that bunion deformity is a bony deformity where the bone is sticking out. And essentially what happens is that we shave this bone down and we remove the bunion. And in some very severe cases, we do other things like destroy joints and we fuse joints together. Fusion essentially means welding two bones together. And so you can see the incisions right here. That's typically how large your incision will be. Now let's look at the minimally invasive approach. Red little dots right there, that's your incision size. That's the exact size of what the incision looks like. So I call it barely an incision. It's just a little tiny incision, a little poke hole incision. We call them keyhole incisions. You've heard me mention this in previous videos. The keyhole incision is literally just a little poke hole, and in some cases the incision is so small that we don't even use suture to close. In this case, the incision is very big. We have to close the incision, one, to prevent infection, but two, because if you don't, the patient will bleed. Now, what's the advantage of the minimally invasive approach versus the traditional approach? Well, for one, and as I mentioned in other videos, cosmetically appealing. There's barely even a scar, and in some cases, patients don't even have a scar, which is really, really nice. I walk my patients day one in a boot for 2 weeks with this approach. With the traditional approach, sometimes we're keeping the patient off their foot completely for 4 weeks, even 8 weeks, sometimes even longer. But with this approach here, my patients are walking right away in a boot for 2 weeks, followed by a post-operative shoe, which is a sandal. So there are a lot of great advantages for this approach versus this approach. Now, the question is everybody a candidate for the minimally invasive approach? I always tell patients 90%, 90 to 95% of the time you are a candidate. There are some instances in which this approach is not feasible. Sometimes patients have had surgery from an outside doctor with screws and pins and whatnot, and so sometimes we need to remove that, and so that requires a bigger incision. Sometimes the bunion is very severe and this approach isn't feasible anymore, and so we are having to remodel joints, destroy joints to get the correction that we're looking for. Here you can see an example of a traditional approach. You see this long sutures versus the minimally invasive approach. There are no sutures in this case. And so you can see the exact size of the incision there, very, very tiny. Again, most patients won't even have a scar after they've healed. And so from a cosmetic to a functional to an overall just better post-op rehab, patients do very, very well with the minimally invasive approach. Okay guys, that's all for today's video. I hope you guys learned a lot. Please like, subscribe, follow me on Instagram, follow me on Facebook. If you have any questions, feel free to reach out to me. If you're in the Detroit area or anywhere else and you'd like to talk about bunion surgery, feel free to reach out to me and we can discuss how we can fix your bunion from a minimally invasive approach. Thank you.